All right, everyone. So my name is Laura, and as you've seen, I'm one of the admins for this for our group. So I thought I would do like a welcome post. We did get a huge influx of members this past week, so I thought I would just do a quick, hopefully a quick video, talking a little bit more about like what the group is, what we stand for, what we're looking to do, what we want to help you do. And you'll kind of get a feel for who I am and what some of our values are. So we'll talk about that as well. So I'm going to refer to my notes a little bit. I was trying to stay organized. I'm not going to do 1,000 takes on this. So hopefully this is good enough at helping you, again, understand what we're about and see if this is the right fit for you or not. And and then where do we go from here? So I'll start off with our disclaimer, right? The admin, we're not doctors. We are essentially medical researchers. We do a lot of reading, a little bit less so on like the videos. So that's probably a gap in some of our experience and some of our research. So as we start posting some of these things, if there's an applicable video that helps or fits within your individual experiences, then that is good and fine. What we offer are thoughts, ideas, encouragement, recommendations. So based off of everything that we've read and or experienced. So two of our admins are Ned from ovarian cancer, and I'm researching in support of my mom, who is not Ned yet, but she's finished frontline and she's got a clear scan, knock on wood. But ultimately, again, this is not medical advice. We're not here to tell you what to do. We're here to connect you with ideas so that you can make decisions and you understand all of the tools available to you. This is intended to be empowering. We want you to be in the driver's seat of your own healing. We follow what's described by Dr. Paul Marik in Cancer Care. It's integrative oncology. So we follow that model. So that includes a focus on relief of symptoms. That includes anxiety, pain, quality of sleep. We're interested in nutrition, nutraceuticals, herbs, natural supplements, and repurposed drugs and lifestyle changes. So fully acknowledge this is a big pill to swallow. This is a huge shift. And in my family, I use the rug ripped out from under us visual. Like that knocked us all in our butts and we had to get up. So again, if all of those things are not things that you need, that's fine. This is a take it or leave it. But at least you understand there's more out there. If it's a timing thing or it just doesn't fit with your values, then again, great. The important thing is that you have the information available to you and you're able to make a decision that's right for you. So that's really what we're about. We're not here to offer guarantees. We're not hearing miracles. We're not like, this is a lot. This is a beast. And I've watched my mom through it. I've seen, like, we've all seen the posts in the normal ovarian cancer groups. Like, they are sad. And this is hard, and this is heartbreaking. And ultimately, like, none of us want, like, we want to live, we want to heal, we want to be better, we want our lives back. Like, we want to give you ideas on how to come out of this. And there is going to be like any huge shift in your life, there's going to be a rebirth of sorts. So let's help you through that. And let's help you figure out what you need to do in your life so that you can come out on top, or at the very least have the best chances, the best quality of life, the best the best chances. To me, I think the numbers speak for themselves from the standard of care model of like 80% respond to chemo. That means that 20% don't even respond. And I'm sorry if this is harsh. This is the researcher in me coming out, but okay. So of the 80% that respond to chemo, 80% then recur. So in all, 16% of women get this and kick it for good. And so to me, like, That's just not good enough. Ovarian cancer has been around for decades. The surgery, chemo, radiation routine has been around for decades. And really, that's the best we can do in 2024 is 16%. I don't buy it. It's not good enough. And that's really what has pushed me to go this route is I want better for my mom. What do I need to do to have my mom be that 16%? And we'll do that. So no stone unturned. Everything is on the table. We will evaluate everything. And that means doing some deep dives in studies and funds and trials and like, well, how does a trial get funded? And how does a study get funded? And how, like, there's, I want to say a huge conflict of interest associated with the cancer industry. Paul Marik talks about that in his book. He talks about like 20 years ago, there were $2 billion drugs in the cancer industry, and now there's what, 20? I look at all of the money they make, and I look at the lack of progress that they've made, and to me, those two things are related. But that's me again. So I try and look. I have a political science background. I have a degree in education. Like, so I try and look at different angles, and as I look at different angles, this is where I am right now. I'm happy to change my opinion if and when more information presents itself. That's how we should learn and grow. That's how science should be done. I'm not convinced that our mainstream scientific efforts are following these values, and I don't think that they actually help consumers. And this is one of those areas where I think consumers are at the butt end of this. But again, that's opinion. Happy to discuss because I do love, I'll say a passionate discussion, but that's for a later post. So with that, again, like this information is not for everybody. If it doesn't resonate with you, like then it's not for you. Then we have supported you and your goal. You've looked at it and you're free to do as you please. That is absolutely still within our line that we want to support you however you want to fight this. And so that just know that that's important to us. A quick note on disagreement. As we start to grow, we're going to have more different experiences. So I would encourage everyone to think from the standpoint of like, what have you read? Like, think of it from a standpoint of like either direct experience or someone that you know specifically. So you'll see a lot of, hey, my mom has done this, my mom has done this, she lives with me. I see everything she does. We cook together, she takes care of my kids still. I mean, like I make protocols for her. So like there's definitely a symbiotic relationship there. But as we grow, we're going to have different perspectives, and we should embrace those different perspectives. And we absolutely should talk about our personal experience. So just before we want to be keyboard warriors, I will ask, like, hey, if you're going to get triggered by something, if you feel like an emotional response to something that someone posts, that is absolutely a clue for you that you've got to do some healing, you've got to do some reflection. So I would encourage you to delay posting if you're feeling emotionally triggered by anything. This is a traumatic experience. And that's going to come with it a whole host of other emotional roller coaster ups and downs that we've all experienced in different ways and different levels at different times. So like, I ask that you please attempt to be aware of where you are in that, acknowledge that it's normal and very possible, but ultimately, like, we're here to support each other. And our posts can be mean. I've seen in some of the other groups, like sometimes it's just mean. Like, why would you say that? So we don't want that here. So again, like I'll tell you straight up, like we don't want that here. Like, this is supportive. This is, can you tell me more about it? We can start with questions, start with curiosity. Hey, how did you arrive at that? Do you have any resources to support that? Like, there's tons of ways that we can show doubt and question without being rude, dismissive, or just mean. So just know that is incredibly important to this group. We want to be a tribe. We want to be here to support each other. And as divisive as our world is right now, we really need to just put that in mind in this particular group. Let's see. Okay, so yeah, I think I said this already, but like, we want you to understand all of the options available, all of the everything, supplements and off labels, and like what are people doing? What are some of the latest studies? What can you do? I simply do not accept that cancer is complete and utter luck. I think something caused it. I think our unhealthy lifestyles, clean food, water, and air is hard to come by for a lot of people, and I think that contributes greatly. But ultimately, I do think something causes it, and we'll talk about that a little bit later. But what this does is it empowers you to be in the driver's seat for your healing, for your care, for your life. This is it. So we're trying to connect you with ideas and people and personal firsthand experience so that we can bridge this gap between these robotic clinical trials and these robotic, these robotic clinical trials. I just got a battery thing. I want to say like just some of these like unsympathetic numbers. So like there is a human component to this, and we absolutely want to bring that out to the best that we can. As far as like some of the other resources that may or may not get referenced, but like educate yourself. And that's, I would say, like, what is the standard of care for your particular cancer? I will tell you the NCCN website. I think it's nccn.org. But National Comprehensive Center Network, that is your standard of care. You got to create an account as a patient, download the treatment guideline. I even downloaded the treatment guideline with risks, where it talks about like essentially, I think all of my mom's possible treatments had like a 60% safety rating. So like, what does that mean? Like all of them 60%. Well, what about the other 40% of the people taking this? I call it a jump to conclusions mat. If you get my Office Space reference, I love that movie, but like I hate to say a choose your own adventure because this is a horrible nightmare, but you can essentially pick, okay, where are you? Okay, stage 3 ovarian. Did you get a partial or complete response with your frontline? Here's, depending on where you were, that determines frontline versus debulking in the middle of frontline, and then you resume your chemo, and then from there it even tells you where some of your maintenance drugs are going to be, Avastin or no Avastin. I think this is U.S. specific, but just from an international standpoint, like I think it's worth going to. They do have links, so if you can follow along in the PDF, it's 241 pages, so don't get too scared. Not all of it's applicable to each one of us. It's just, again, there's specific links in there that show you, okay, like if frontline fails, then what do we do? Okay, how do you get on some of these other, these second and third line chemotherapies? So NCCN guidelines, treatment guidelines are what you want. You got to have an account, and you go in and they have ovarian cancer specifically. It's ovarian and primary peritoneal. Another good one is the manufacturer's insert. So go in and just Google like Avastin manufacturer's insert. So like, and that tells you like, what did the manufacturer, what are they publishing with their drug to the pharmacist at your oncology clinic? What is published data? And it shows like what they did. And I'll say for, my mom has MVASI, which is like a biological similar Avastin equivalent, I want to say. But it talks about like, okay, the 3,000 women in this trial plus the 3,000 women in that trial found that, you know, progression-free survival for people in my mom's case with Avastin, that it included progression-free survival by like 6 months and overall survival by 6 months. So I want to say it was like 22 months for progression-free survival and up to 36 months for overall survival for people in my mother's bin, so to speak. So not a good bin to be in, right? Like, but at least we know, like, okay, what is the benefit of Avastin? Compare that with the risks. And based off some of this, my mom has told her in college she does not want Avastin as part of her maintenance. So that's how she feels based off what she's read. And she's like, if it's going to be, if that's the difference, then she's like, I don't even want it. But she also knows I'm going to make her a protocol, and then we're going to hit this from other angles besides that one specific angle. So a note on that. As far as values, I do want to say, like, I have a background in the military, so if I swear, sorry, sometimes I get heated on some of these, and it's just going to come out, so sorry, but that's just who I am. I try and keep it under wraps. My kid has a swear jar for me, so I do literally pay for this, but When I talk about my mom's oncologist and how dysfunctional that relationship is, I do get fired up. So just know that it's probably going to slip out from here and there. I'll say as far as like values for this group, like we talk about like direct experience. We want to hit that balance between direct firsthand experience and what the studies say. And I want to tie that in with like some of the integrative oncology focus points, right? So relief of symptoms, relief of pain, nutrition, nutraceuticals, herbs, natural supplements, repurposed drugs, right? So like, here's a list of things that I have researched for my mom to help with all of those things. None of this was mentioned by her oncologist. None of this is mentioned by her nurse practitioner. None of this is like, none of these people on her quote unquote care team cared enough about her to help her actually get through chemo. And first and foremost, in my mom's opinion, is she got a cold cap. I had her watch, what was it, like the kitchen? There's some lady on YouTube who had a video and she talked about her cold cap to try and keep from hair loss. So I had my mom watch that video. And so when we walked into the oncologist and said, hey, she's going to want a cold cap. And I said, oh, they'll have ice available for you. You know, not necessarily a cold cap, but they'll have ice available for you. So she walked in there. And they're like, well, what are you talking about? We don't do that. So on chemo day, right? Well, we don't do that. Thanks. Okay. So she went through chemo. 2 weeks later, she lost her hair. And then she ordered a cold cap. So she had the cold cap available and she got the mittens and gloves. She had the cold cap available from her third chemo on. So that's June. She now has hair growing. So she had June, she had surgery, she had more chemo. That cold cap means that she kept her hair. There was another lady in here just recently that talked about her cold cap. And I was blown away that here she's showing a picture of herself done with chemo for a frontline and she has a full head of hair. And like, do they know how much that means to women? Like, are you a psychopath that you would just not mention that cold capping would help women keep their hair? Like I can't make sense of this. Other than like, they just don't care. They're there to do a job. They're there to follow NCCN guidelines and they're not there to do anything beyond that. So that's number one for my mom. So I'm going to say that number one because she is pissed. She's glad that she got the information. She's glad that she was able to, like, her hair is starting to grow back. But like that is like front and center, like one way that they could have helped people like my mom, and they simply don't. Coconut oil for regular movements, fasting to avoid nausea. Like, so she has lost weight, but she's stabilized. Hasn't had the nausea. She's played pickleball. She goes to the gym. Like, as far as like some of the extreme discomfort that it seems like women are reporting, they look at her like she was smoking crack. Like, what do you mean you're going to fast before chemo? She's like, yeah, like my daughter's read 2 books at this point that say fasting before chemo. Like, and lo and behold, like she has escaped a number of those symptoms. I supplemented her with a probiotic. Okay, if chemo's going to destroy your microbiome, then we probably need to phase that in after like a couple days after you're back from chemo. Like, this isn't rocket science. The information is there. You just have to look for it. And they won't. Let's see. Cranberry for UTI, beef liver supplements for red blood cell counts, getting those back up. Potassium and electrolytes, a low-carb electrolyte for her leg cramps. Parsley and boswellia, thanks Vanessa, for white blood cell count. Lion's mane for neuropathy. She was dropping cups. She, like, I made a cup for my son. I used like glass etching paste to like make a cup for my son, and she was putting it into the cabinet, and she dropped the cup and it shattered. So like, she could have started on these things right away, but instead she had to have symptoms. I had to dive into the books, and I would do it again. But I'm angry that I did it all by myself without like these people with so-called experts looking down at us the entire time. So obviously, again, I'm still mad about that. And again, someone help me make sense of why they can't even understand what it would help, what it would take to actually help patients through this. So absolutely direct experience. Like, there's no phase 3 clinical trial that talks about taking grass-fed beef liver pills to help your red blood cell count. But I'll be damned. My mom started taking those, excuse my language, she started taking those and her counts went up the very next week. That is not an accident. So there is very real value in personal experience and honestly experimentation. You are a sample size of 1. Be your own advocate for your own experiment. Like, I only care about, like, I don't care that everybody else may or may not, like, all I care about is that my mom makes it through this, and that's, and we will adjust her protocol, like, to get that. Yeah, I mean, we care about, like, making sense of things. Like, cancer is scary. It is complex. We're learning cellular biology. We're learning about DNA. We're learning about this and that, and all these things that none of us probably have any degrees in. Maybe some of us do. That would be great, but I certainly don't. So let's be, like, kind to ourselves, and but also don't be scared. Don't be scared about not knowing. And let's be kind to ourselves for not knowing what we didn't know. Like, as we start to learn, as we start to figure out how to get in the control, in the driver's seat of your own healing, there's going to be some setbacks. And the benefit of all of this is, like, if something isn't working for you, then stop. Like, you're doing it, then stop. And you need to have mechanisms in place to check your progress and see how you're feeling. And you have your labs. Like, we have lots of things in place that we can utilize, or at least understand where are you assuming risk. So, like, ultimately, like, what is the risk of what we're doing, and the $1 million question, like, is it going to work? Is it effective? So that absolutely is part of where we want the group to go. Is I want to answer those questions, and what I'm anticipating is essentially polling the audience at some point of, like, okay, you achieved NED. What did you do? And then that will inform newer group members as they come in. Like, let's share that knowledge. We need to compile it and share it. That's obviously a huge part of why I wanted to do this. Does it work? What helps? Okay, 2 more things. Free speech. Free speech, as described in the Bill of Rights, means that we can and should talk about anything that we freaking want. However, Facebook is against that, to be honest. And I hate that we are where we are, that we can't say what we need to say, but at this point, we need to use code words. And with that, like, there's gonna be some controversial topics that we're gonna talk about. So, like, I want to say that from, like, let's see it from the standpoint of, like, let's appreciate the diversity of thought, and we'll do it respectfully, of course. But, like, we absolutely need a forum where we can talk about anything that we need to. So again, no stone unturned. We need to talk about a lot of things that are controversial, especially when we talk about anti-big pharma and vaccines and diet and all sorts of things that there's probably more than one answer. There's probably more than one truth there. But we want to help you find your truth. And really the biggest key to that is being exposed to different points of view. And you certainly won't get these from the National Cancer Institute and your ovarian cancer, whatever society. Like, I just, they have one model and one model alone. And I think they're a huge part of why we're here today. I think that questioning that has brought us here. And again, like, if this isn't a message for you, then leave it. But if it's resonating with you, then again, like, you're with a group of people that have all questioned this, and I think the numbers speak for themselves. But ultimately, like, we seek truth, and that's an individual truth. I'd like to expand it to make it a little more collective, but again, like, what I would unabashedly fight for is I want each and every one of us in this group to not have to worry about this ever again. I think it would take essentially a holistic and combined approach to get there. We have to eliminate some of the causes, eliminate some of the environmental toxins. We need to and ultimately we need to fight and win against this disease. But we need truth, and we need discernment. We need to trust our gut. We need to trust ourselves, so that we might be open enough to receive the truth that we need. So without getting too spiritual or religious on you, I do think there's a reason that we were brought here. For better, for worse, I do think there's more to life than just coincidence. Okay, I think that about sums it up. So that's what the group is. This is what we're looking at. Next post I want to do is essentially a review of some of the books that I've read. I'll do a summary. Essentially, like my goal as I'm reading these books is to tailor it to ovarian cancer. A lot of these are generic, and this is where, okay, it's like we pull on some of these ideas from the books that we've read, and then that helps our searches be a little more refined. Okay, so if I learn about statins, say in Paul Marik's Cancer Care, then okay, I'm going to start looking for statins on PubMed or Google Scholar or wherever. So as far as like how do you get started doing your protocol, that'll be a next video. I just got to organize some of the information a little bit more. But if you have questions in the meantime, like I want to get started on a protocol, or you just want to like peruse through old posts, that's fine. But I want to help you again achieve your health goals. I want to help you kick this, and I do think there is again a holistic approach that needs that will give you your best chances. Okay. So with that, again, welcome to the group. This is me, Vanessa, an admin. Vanessa has done her own admin posts again, so you'll see her doing like her book clubs. She's doing Nasha Winter's metabolic approach to cancer, so we're in the midst of that, and then and we've just added Rebecca to the team as well, so we're absolutely excited to have her. Feel free to ask questions, and I encourage all of you to share what your experience is and what worked and what didn't work, so that we can help each other, again, achieve the health that we so need. So with that, have a good one and take care.